All right, let's move on to our question. So the nurse is caring for a client receiving bolus feedings via a nasogastric or an NG tube. All right, the nurse should place the client in which position to administer the feeding. All right, you're going to put down in the comments your thoughts, whether it's A, supine, B, semi-Fowlers, C, Trendelenburg's, or D, lateral recumbent. All right, that's A, supine, B, semi-Fowlers, C, Trendelenburg's, or D, lateral recumbent. All right, put your choice down there, A, B, C, or D, and then follow the next video for the correct response with rationale. All right, see you next time. All right, so a patient is at high risk for aspiration when they're having an NG tube placed, right? So we're going to trigger that gag reflex potentially. So we really want to have the head of the bed elevated 35, 40, 45 degrees, or the semi-Fowler's position is the position that puts the patient in that elevated head position. So this prevents that complication of aspiration, and the rest of those options were just putting that patient at risk for aspiration. Okay, so Trendelenburg wouldn't work, right? Supine would not work either. Okay.